Welcome to the STS Advocacy Legislative Fly-In. My name is Amir Sarkashik, and I'm an integrated cardiothoracic surgical resident at the University of California, Davis in Sacramento, California. The elimination of lung cancer remains one of the core advocacy priorities of our society's Political Action Committee. As such, we ask under this advocacy priority to co-sponsor the Ban Smoking at VA Facilities Act. This bill would prohibit smoking of all tobacco products, including cigarettes, e-cigarettes, cigars, and pipes, in Veterans Health Administration facilities, including medical centers, nursing homes, outpatient clinics, and readjustment counseling centers. This legislation would correct our current failure to protect veterans from the dangers of smoking and secondhand smoke. Rates of illness, disability, and premature death related to tobacco use are disproportionately higher amongst veterans because both active duty personnel and veterans are more likely to have ever smoked or are currently smoking in comparison to the non-veteran adult population. Partly due to this increased rate of smoking, veterans face a higher incidence of lung cancer when compared to the civilian population as well. Studies have shown that lung cancer rates, unfortunately, amongst veterans are 25 to 75% higher than the national average. The Surgeon General has determined that there is no safe level of exposure to secondhand smoke, yet sick and disabled veterans are consistently subjected to secondhand smoke in order to receive medical care. Besides lung cancer, many veterans suffer from COPD, or chronic obstructive pulmonary disease, hypertension, and coronary artery disease, all of which are exacerbated by secondhand smoke. VA facilities should join the thousands of hospitals, health systems, and clinics across the country that have decided to protect their patients with smoke-free campuses. Why do VA campuses have smoking centers in the first place? Well, in the early 90s, the tobacco industry created a public relations-focused grassroots veterans opposition group that lobbied Congress to pass the Veterans Healthcare Act of 1992, a law requiring that VA facilities have designated smoking areas, arguing that it would be unpatriotic to deny veterans this, quote, freedom. Industry consultants protect the tobacco industry profits at the expense of our veterans' health. Currently, the VHA maintains 15 indoor smoking areas at its facilities and 971 outdoor designated smoking areas. These areas pose a clear health hazard to all patients and staff at these facilities. The Prohibit Smoking at VA Facilities Act would ban indoor smoking areas immediately and ban outdoor smoking areas within 5 years. E-cigarettes are included in this ban. According to the VA, approximately 20% of veterans enrolled in VA healthcare are smokers, and some offices may be concerned that veterans will be so opposed to this policy that they will stop receiving health care. However, the major groups representing veterans, disabled American veterans, and veterans of foreign wars have opted to stay neutral on this bill. It is important to emphasize that most non-VA hospitals do not allow smoking areas on campus, that the existence of smoking areas can be traced to the tobacco lobby, and that veterans deserve the same standards of care as any other patient in the country. In addition, numerous studies have shown that campuses that have gone completely smoke-free see reduced rates of smoking amongst hospital staff and patients overall. In co-sponsoring the Prohibit Smoking at VA Facilities Act last year, Representative Phil Rowe, a Tennessee Republican, physician, and chairman of the House Veterans Affairs Committee said, quote, "The health and well-being of our nation's heroes should always come first. This common-sense legislation would bring VA smoking policies into the 21st century, ensuring veteran patients receive the same considerations as patients in the private sector. STS members treat veterans at VA hospitals on a daily basis. Patients deserve the best possible care. Cardiothoracic surgeons and the patients they care for should be able to make informed decisions in a safe, smoke-free environment, as in any other medical facility in our country. Bringing VA facilities in line with the vast majority of public and private hospitals will benefit everyone. Veterans deserve to receive care that prioritizes their overall health. As such, the STS supports efforts to promote a smoke-free environment at all hospitals owned by the VA through the co-sponsorship of this legislation."